I practiced emergency medicine at various level hospitals, and over time transitioned away from that brand of medicine due to being unfulfilled in my career. It turned out that during that time I was prescribing a lot of medications and recommending implantation of various devices that ultimately I found that the patients weren't really benefiting on a long-term basis. It was a natural segue to bring about the use of stem cells. These are stem cells that we're harvesting from the patient's own body, and it's using these cellular physicians to not only diagnose what the extent of pathology is in a joint or elsewhere in the body, but they also have therapeutic benefits. Through the liposuction procedure, we isolate stem cells within that adipose tissue, within that fat tissue, and then over the course of several weeks, we replicate those cells in a lab under sterile conditions to many times, hundreds of times, the number of similar cells. These are live cells. These are cells that are able to hone in on where the injury is. These are cells that, through their own quote-unquote language, they try to decipher what the extent of damage to a cell is and how best to nurse that cell back to health. And if it can't do that, then directing that cell to undergo a process that we refer to as apoptosis and essentially weed out those damaged cells that are beyond the point of no return, thereby making room for healthier cells to come in and take their place. We've had high school athletes who were on the verge of getting football scholarships, sustained head injuries, and the parents were told to essentially withdraw care and that individual would probably not have a quality of life if they were to survive at all. And after undergoing several rounds of stem cell therapy, this patient still comes in. He lives in California with his mother, and he's doing fantastic. I've done these procedures on, I think my youngest patient was 6 months old. And in most of those instances, the parents hadn't banked their child's stem cells. And now we're looking at extracting fat in order to isolate the stem cells that we're after. And in those instances, it becomes a challenge from a medical provider standpoint, be it the nurse or the physician, where we have to sedate that patient to make it easier on him or her, make it easier for the parent. And that carries some element of inherent risk. If these cells are stored at the time of birth, when these cells are numerous, they're very vital, very responsive to chemical signals of injury, then they're available to be deployed, be it for neurologic conditions, concussions, for example, or musculoskeletal injuries. And I've certainly had patients who maybe have nothing wrong with them. There's no injury, but they're very active and they want to stay at that level for an extended period of time. They want to be competitive. They want to go on grandiose sort of ski trips, for instance, and they don't want to be lagging behind someone who's 20 years their junior. Well, the way to do that is to sort of optimize your biology for healing and regeneration. You should just expect to get injured because that is kind of the status quo that we're all sort of born into. Is we're going to be slowly getting chipped away at. And so stem cells are the repairers of that process. And the significance of vital cells in American cell technology is that it gives control back to the parent, back to the patient.